All right, we're back. This is Senate Health and Welfare, Friday, April 5th. And we have a resolution that's been introduced by Senator Byhowski and others. And when a resolution reaches a certain level, it gets treated as a bill, and that's what this one is. And we thank you for bringing this to our attention. So why don't you give us the broadest introduction, and then we have Mike Turnick here to go through the resolution.
Perfect. For the record, Senator Connie Davidson, I represent the Central District. As I'm sure this committee is very well aware, we are facing a crisis with the opioid epidemic and substance use disorder, and just a rising number each year of people who are dying. And this resolution gives us some of the data around that, and actually declared that there's a public health emergency. I recognize that resolutions are really statements and they don't change policy. However, I was asked by a constituent who has lost multiple loved ones due to the opioid epidemic to do this and to make a statement, and I did not feel it was my place to tell them that that wasn't something that we should move forward with. I do think that making statements like that in our positions do matter. And so that is what this resolution does, is really makes that statement that we're facing a public health emergency.
Thank you for that. And in your research, did you find that the phrase public health emergency has any implications in terms of what we are required to do as a result, or is it simply a statement that then supports the work that we're doing in the state?
I think that would be a better question for legislative council.
But I wanted to ask you.
Yeah.
In case you had a response.
Yeah, no, I certainly don't know that it does. In my understanding of resolutions is that they are statements, not policy mandates. But it's certainly worth connecting with legislative council to make sure that my understanding is correct, because I'm also not a lawyer.
All right, good. Thank you. And I'm looking at some of the data that's in here. We may want to update that a little bit because some recent reports have.
Yes. Yes, that is the hard thing with data, right?
Yeah, no, it goes up every day.
Yes. And part of why I think, whether the language needs to change a little bit to make sure that we're making a statement we want without policy implications, I certainly think that is okay. But I think, to your point, it goes up every single day. Is why people are really asking for a clear statement from the members of the General Assembly that we recognize that it's an emergency.
Thank you. Thank you for that. Thanks for leaving. It sounds like a very busy. This on the youth secure.
So no, this is on the women's correctional facility.
Oh, I would like for you to go back.
Okay. As long as there's no other questions, I'm happy to go back to that conversation.
Thank you.
Thank you.
Thank you very much. I appreciate it.
Nice to have a woman on that committee.
Yeah. So, Michael Chernick is here. First time.
I think this session, yeah,
Yes.
it's probably not the first time in
No,
my
not
career
the
as
first
Host
time.
Counsel. And I am going to take advantage, good morning for the record, Michael Chernick, Legislative Counsel. I'm going to take advantage of the fact that I have a larger type version of this.
Oh, good.
So I am going to work off that and not the smaller font, if you don't mind.
No, that's just fine.
As I said, Michael Chernick, Legislative Counsel, before I review this for you line by line, I wanted to note that I was shaking my head and concurring. This resolution cannot change any policy because it is only a resolution. There are limited instances where resolutions can have an actual impact on terms of they mean something in terms of as a directive. When you're adopting a resolution with respect to your own rules or any procedures within this building, those are real, those have effect. Secondly, there's a very limited category of resolutions dealing with land transfers from the Department of Forest and Parks and Recreation. And that legislative ratification is for real, and it is a statutory authorization for those. But short of those special categories, these are simply statements of a desire, statements of policy on your part, but not if you actually wanted to declare an emergency with elements that would then flow from it, you'd actually have to pass a bill for that. With all that being said, good morning, and let's go through this resolution. This is a joint resolution, and of course, the numbers in here for your information were effective as of when I initially drafted it in mid-October. Senator Bahowski and I did some quick updates that she had wanted in February, but we didn't work with the numbers at all. It was simply she wanted me to make some very miscellaneous language changes, which I did, which is why this is the 2.1 on my draft and not a 1.2. So with that, whereas the use of drugs, especially opiates in Vermont, regardless of whether the use originated with an initial prescription and over-the-counter purchase or the purchase of an unregulated drug, has led to an increasingly severe opiate use crisis that has killed far too many Vermonters. And of course, that clause was meant regardless of what the numbers are.
Yes,
Whereas the victims are not only the individuals who die, but also their families and friends, creating a broader human tragedy. Whereas Department of Health, the department data reveals the severity of drug overdose deaths in Vermont. And whereas the number of Vermonters who have perished due to drug overdoses, be they designated as accidental or undetermined, continues to accelerate, rising from 42 in 2010 to 264 in 2022, and representing a 500% increase over this time frame. I should add, 2022 was the latest data that I had at the time I wrote this in late 2020.
we understand that.
Yeah. Whereas of these drug overdose deaths, those that involved an opiate grew from 37% in 2010 to 239 in 2022, excluding those deaths deemed to be by suicide. Whereas the opiates causing these deaths are now more toxic than in prior years, as fentanyl, a synthetic opiate that is 50 times more potent than heroin. I'm changing pages here, one moment. Was involved in 93% of the 2022 opiate overdose failures, and according to preliminary data, in 110 of the 115 drug overdose deaths recorded for the first 6 months of 2023. And whereas other drugs contributing to overdose deaths in 2022 included cocaine, 49%, heroin, 9%, gabapentin, 13%, up from 2% in 2021, methamphetamine, 8%, and xylazine, which the FDA has only approved for veterinary use, 28%, up from 13% in 2021. Whereas 87% of opiate-based drug overdose deaths in 2022 involved at least two substances, and 25% involved four or more. And whereas this rise in the number of drug overdose deaths is occurring despite the existence of extensive state and federally funded treatment services. And whereas these services are clearly insufficient in reaching all individuals experiencing a substance use disorder, because according to a 2020 social autopsy, the department documented that 76% of the Vermonters who had died from an accidental drug overdose had no known history of excessive treatment. And whereas the severe problems associated with opiate use disorder show no signs of abating, and the implementation of more effective solutions is an urgent imperative. Now, therefore, be it resolved by the Senate and House of Representatives that the General Assembly declares the increasing number of drug overdose deaths in Vermont to be a public health emergency, and be it further resolved that the Secretary of State be directed to send a copy of this resolution to Governor Philip P. Scott and Commissioner of Health, Dr. Levine, and the resolution.
Okay, thank you. That was really helpful. And the data, there is newer data probably than.
I suspect so, as I
Just leave that
indicated.
one to you.
Right, I
Yeah.
wrote this in October, and at the time, that was the very latest I was finding on the web.
And then my question about any addition of other drugs like ketamine, I don't know if you want to do that. And then in the, whereas under the 87%, the next whereas.
We're,
So
so you're on page, my page two.
1, 2,
Hold on.
3, the
I see
third,
we're 87% of opiate, yes.
the third whereas from the bottom, so it's the
Yeah.
one below that.
Middle of page two for me, okay.
So, state and federally funded, is there a way that we can mention opioid settlement dollars in there as well? Because it's state, federal and settlement,
Emergency services.
Settlement dollars.
Where are you?
the
She
third,
is,
whereas-
here's 1, 2, 3.
go to resolved and then count up 1, 2, 3. And you've got, whereas the rise in the number of drug overdose deaths is occurring despite the existence of extensive state, federally funded services.
I can mention settlement.
Somehow settlement gets in there.
I can easily do that, Senator.
And then my other comment, and just in the quick look through, because it's. Seems like a good start here, very good. Is there, this is a question for the committee, should we indicate that whereas Vermont data reflects national trends? And so that we can also send this resolution to our federal delegation? It's just an open question. Does it make it broader than we want? Or does it allow for us to,
I mean, we can send it to whoever we want.
yeah,
We don't.
we need to say reflects national trends.
I don't think so. I think the opioid crisis in Vermont is actually worse than national trends. So, I think having it focus on Vermont is helpful, but we can send it to our delegation.
Well, I know that, so it's up, I know, Michael, do we have any data? I know we've seen data.
There's all sorts of data,
That's looking at national increases.
I certainly can compare to national increases if you so prefer. Or as Senator Hardy said, if you feel this is sufficient, I can simply add the congressional delegation and the transmission clause with no difficulty.
I
Whatever
mean,
you
we
want.
could do that. I mean, I'm happy doing that. I don't, if we could say that whereas much of this data reflects national trends, because I know that there is some data here that does reflect national trends and increased utilization.
I could speak of
Contamination.
that the data reflects a growing national problem, something in that sense.
Yeah, let's do that.
That way we don't have to start comparing.
I don't want to
numbers. Yeah.
compare numbers.
Why don't we say,
I agree with that.
I'll have a clause and reflects, somewhere I'll put reflects national trends, a growing national problem. That Vermont reflects a growing national problem, something to that
We could
effect.
take this a lot of different places, but does that work for you, Senator Hardy? Is that okay?
It's fine. I mean, I don't think it's necessary. I think focusing it on Vermont and the problem we're having in Vermont is important and like I said, our crisis is worse than most places in the country. So I think while it's bad in other places,
Just trying to figure out how to get our federal delegation to, well, they're doing a lot already on it.
well, I don't
Congress to do.
I think our federal delegation should be doing something about it to the extent that they're able to. Just because it's so bad in Vermont, it doesn't have to reflect national trends, but
True.
that doesn't matter to me that much if you.
Well, let's see what it looks like.
Let me
I'd like to
create
see
a
what it looks like.
sign, as a clause, I'm thinking something along to the fact this crisis in Vermont reflects a problem, but I'll have language of something of that nature. And then all of you can decide if that's what you want or don't want, and
Let's
if you
do
want to
that.
make changes,
Let's
I'm
see what
happy
it
to
looks
make whatever
like.
change.
I'm
But
happy.
in the meantime, I will also include references to settlement funds. And I will also, regardless of how the final clause reads, with respect to national, I will for right now add in the congressional delegation as recipients.
And you'll update it with the most recent data. Because I think there are now 2023 data
Yeah, there is.
available, but
Right, the number of deaths has gone up, the number of. All that. The overdoses.
I can certainly do that. This all came from the Department of Health, so I can go back to it, but.
Yeah, I think when Commissioner Levine testified in here yesterday, he had new data. So,
Which means that should be up on the web by now.
yeah, it should be.
yeah.
And if not, I can make an inquiry, but for the moment, I'll check on the web. It should be on.
It's not all there, but. Questions for Michael? Go ahead.
I have a statement, nice job on that. I don't think it goes far enough. You can claim a state emergency, and this makes a statement, but until you deal with the real problem of the open borders, including our own northern border, and catch and release, cashless bail, and not doing
Retail
anything,
theft.
and not doing anything to criminals that come through here with these drugs. This is just words.
So it is, but it is, these are words that our committee can support from a health and welfare perspective. And other committees can look at and understand the severity of what we have in our state. You're right about, there are a lot of other issues, public safety issues included, that need resolution.
As I said, Senator, if you wanted to do something that was actually doing it, that would take legislation and not simply a resolution. Later.
Was that, you say that again?
Introduce it.
In other words, if you want to do an action,
Like another resolution that.
well, you could, well, there are two things you could do. If the committee decided it wanted a different language, of course, I would write whatever the committee wants, that goes without saying. But if you wanted to take and, begin legislative, do legislative action that was concrete and actually, triggered various actions on the part of the state, and of course, the General Assembly can't direct the feds, but in terms of on part of the state, that would require a bill that's beyond the scope of a resolution. I'm just speaking very generically.
I mean, we could list all the bills.
Or whatever you want to send, and that's your call completely.
Think about it. Think about whether there's anything you'd like to add here.
Do you want,
This.
Let- if I may, Senator, and all the committee, from listening just now, are you looking for me to add requests of what the Fed should do? I mean, I can do that in a resolution if that's what you want.
No.
No, I'm talking
no,
about
no.
what we can do.
No.
You know, we can't control anything above Montpelier. I don't think, but we can let them know what we want.
If there are,
Right.
if there are other items that you want in here, let me know and I can put them in. That's not a problem. Just my only comment is that wherever you're putting in, you're making a statement, you're not actually executing something that happened.
I think it's good to keep it focused the way it is.
Other than,
Yeah, I'm not comfortable adding any other.
except for my reference to the settlement funds, updating the data and that
Potential
one clause.
Potential clause.
That one potential clause with respect to comparing us to the rest of the country.
Okay,
Now, what's your time frame, Senator?
so we can put this on whenever you have it ready, we can
Well,
look at it.
when would you like it? You're the, I mean, I can't.
I
do
don't
5
have
minutes.
my agenda in front of me for next week. Will probably not be Tuesday or Wednesday, it could be Thursday or Friday.
Then that being said,
Is that-
that's totally fine. I will more than aim, I will have this ready Thursday to be available Thursday morning. If you don't do it Thursday morning, fine, it'll just sit for a day or two till you get to it.
That would be good, and if you do have it finished, as soon as you have it finished, send it to Kiki. And she can send a copy around to each of
I'll
us.
have it to you before Thursday.
Yeah, that'd be great, we can review it.
Why don't we say that so we're being firm about this, that I will have this to you by noon on Wednesday. Does that work for everybody?
Excellent.
Okay. I'll give you time to get it edited and then look at the data and all of that. Okay,
My question, I have one more question. because
Sure.
I'm looking at the last whereas, and it says, the phrase I'm looking at is the implementation of more effective solutions. I can read that one of two ways, more of the solutions that we have, or more.
Oh, yeah.
So I'm wondering if that phrase, we might clarify what we mean there. More effective solutions.
alternative solutions, would you?
Well, I'm thinking
Are you talking?
The very last
increase,
whereas,
you know,
Senator, before my.
increased attention, increased numbers, I'm trying to figure this one out.
Is it a greater number of effective solutions or
Yes,
is it
or is
effective
it-
solutions that are more?
When I wrote it, if I may, Senator,
What was the thinking there?
what I was thinking,
Yeah,
and it's not necessarily what you were thinking, but what I was thinking is that there needed to be different solutions, and maybe more was not the right word.
right. So so we need both different solutions and greater attention to current solutions that work, have
Greater
beneficial
emphasis on the-
outcomes, have,
On proven solution, okay.
yeah.
Let me play with it, and then we'll
Okay.
see new language, I have a
Yeah.
note on that. And then if it's not exactly what all of you want, I'll change it again, no problem.
All right, let's do that. So if we have something by Wednesday at noon,
Yeah,
we'll.
that I will guarantee you for Wednesday.
Okay. All right, that's very.
That's not a problem. At all.
Good. Are we good with this? Okay.
See where it looks in terms of my writing, where we go.
Well, resolutions may not have the power of law, but they certainly have the power of expression.
Well said.
And of course, you understand this is a joint resolution, so whatever you do in this chamber, it still needs to go across the hall of the house.
Yeah,
Unless you were to change it to a Senate only.
well, we can talk about that. Think about that as a committee. Think
Well,
about that.
may I, and again, I'm speaking generically, not advocating in any way, but what I tell everyone on these is that there are pros and cons on both sides.
Yeah,
The pro side is that if you do a Senate only, you decide to move this out and this passes the Senate, that's the end. And it's done and it's official. On the other hand, when you do a Senate only, it does not appear in the acts and resolves on the white books. It appears on the website and it appears in the Senate Journal calendars, but not in the acts and resolves. And it doesn't have probably as great as an imprimatur, a joint resolution as a Senate only as it would as a joint. But again, that's entirely your call. I'm just telling you what the pros and cons are both ways. And also noting on the fact that in the fifth of it.
okay.
So you all can think about what you're doing now. If you do decide to change it, it's easy enough for me to do, not a problem.
Thank you.
Thank you.
All right. Okay. Representative McGuire available now, because we could begin testimony. I know we're very crunched for time.
We're ahead of time.
We are a little bit ahead.
Can I run this upstairs real quick?
Not yet.
I can say a word and I'll go.
Is Representative McGuire? So, so let's go off live for 7 minutes, back to 10 of, and